We're about to go into the health check. The health check is a feature that happens on the House of Zoo every single Sunday from 11:40 to 11:50 with Dr. Kieran Bhagat, who is going to be on the line, who is on the line right now and is going to be telling us a bit more about how to take better care of our bodies. Good morning, Mr. Dr. Bhagat.
Good morning. How are you, sir?
I keep on messing up your title, sir, and I'm very sorry for that.
Hey, what's in a name? It's more important. The information is more important, sir.
True that. There's going to be today we're going to be talking about doctor visits. To my understanding, you and Z were talking about doctor visits last week, but you're going to be talking more about why it's important for you to visit your doctor routinely. There's a thing that's called a routine checkup that people tend to neglect, and we're going to be hearing more about that from you today.
Yeah, last week we talked about how to be a good patient and always to ask questions about things that are being done, the medicines that are being given, why they're being given, etc. Today we're going to talk about a subject that is increasingly requested, and I think the public needs to understand its value and its downsides, and that is, medical screening. Medical screening basically, for those that don't know, it's a screening that can detect problems early before you have any symptoms, and finding out about a problem early can often mean that treatment is more effective, and finding out again if you have a health problem or increased chance of a health problem can help, I guess, people make better informed decisions about their health. And I think, it's important to understand that everybody should undergo medical screening at whatever age. And just to get started, those that are listening that are sort of between the ages of 20 and 30, I would always recommend getting a simple basic test, which we'll talk about in a minute, every 2 or 3 years if all is well. Then after that, if you're in your 30s to 40s, maybe every second year, and then definitely after the age of 50, almost annually, and because these things are important. And when you're young, sort of some simple things to get checked always. And if they're normal, you can disregard them for a couple of years, depending on your age. And the first, and of course, it's close to my heart, excuse the pun, because is to check your heart. And then, so, whenever you go, it's the reason why whenever you go to a clinic, whether you've got flu, whether you're going for a vaccination, the nurse or the doctor will check your blood pressure. So blood pressure is the leading cause, high blood pressure, of death. So always get your blood pressure checked. And it doesn't matter what age you are. Blood pressure is normal if it's less than 120/80. It is a misconception that blood pressure rises with age. And, blood pressure of 140/90 can shave off 10 years of your life slowly. Ooh. Be careful about that. And then, of course, the other issue that's hitting Botswana big time, like the globe, is cholesterol screening. So get your blood pressure and cholesterol checked, get your eyes checked, of course, get your teeth checked, get you to have a physical examination where the doctor listens to your chest, feels your tummy. That's basic stuff that everybody knows they should be doing. And then, as I always say, it's important to ask the doctor, what's the value of the test and how sensitive or reliable is that test. For example, we in medicine talk about statistics. If the test comes out negative, say you're testing for, bowel cancer, and if the test is negative, you can ask the doctor, is this test, how sensitive is it? What's the likelihood that it's a false negative or it's a false positive? Because sometimes some tests are not as accurate, and you can go away thinking, can't say I'm going to be in trouble, when actually the test itself is not very sensitive or specific. So ask the value and the importance of that test as well. And so, the benefits of this stuff is to identify problems you have, early detection. An example in women is mammograms. Mammograms are sort of ultrasounds of the breast to find breast cancer. And another one is colonoscopy, where we put a camera up your bum and actually look for cancer, because breast cancer and colon cancer are rapidly rising. Now, if you have a family history of breast cancer, generally start saying, get checked, as early as your 30s. Otherwise, women after the age of 40 should basically have an annual mammogram to look for breast cancer. In terms of colon cancer, if there's a history in the family of bowel cancer or intestinal issues, liver cancer, you need to make sure you're checking on a regular basis. Many of these cancers also actually run in families. So that's the most important thing in terms of recognizing something in their early stages. So it's really, really something that all people should be checking. And then, of course, there are simple things like sugar tests. If you are, fairer in complexion or Caucasian or white, we always say look for skin cancer, because we live in a harsh climate with a lot of sun. A lot of the white population are much more prone to skin cancer than us who are darker in complexion. So it depends on your age, it depends on your family history. If you are overweight, already you're at a risk factor. So make sure that, if you're overweight, check your weight, your body mass index, your percentage fat. It's all readily available in most clinics and most hospitals and facilities around the country, and they're actually not expensive. Somebody just asked a question here, Naka, what about Pap smears? For those that don't know what a Pap smear is, Pap stands for, I've forgotten, Papa Nicola. It's a Greek guy who developed this test, where it's a test that women undergo for cervical cancer. And generally women over the age of 20 should have regular Pap smears up to the age of about 55 to look for cervical cancer, because it is something that we can actually now vaccinate against, and also if you pick it up early, you can actually treat for it. And clearly, as you get older, more diseases come on board, and so you need to screen for those things. But believe me, an ounce of prevention is a pound of cure.
Yeah. I hear you talking a lot, Dr. Bhagat, about a different kind of test that people can go to the doctor to get. And I heard you mention something about breast cancer, and you just talked about the Pap smear, which is a gender-specific test. So I want you to talk about that a bit more. What are the gender-specific tests that people need to get? Because you hear a lot of girls our ages that are young speak about really painful periods and stuff. People don't go and to the doctor and get themselves checked up. So what are some of the gender-specific tests that we need to watch out for?
Very good question. I think the gender-specific ones are basically mammograms for women and Pap smears for cervical cancer and breast cancer, respectively. In men, people don't know about it. We talked about it last year. As we encourage women to examine their breasts and teach them how to examine their breasts, men should also examine, believe it or not, they should examine their testicles. If you don't examine your testicles, you can also miss testicular cancer. And you can show men how to do it. They sort of balk at the idea, but it's an important thing to feel your testicles, to see if there are any lumps or bumps, if they're growing, if they're painful, if they're enlarged, if the nodes in your groin are enlarging. You need to go and see a doctor. Yeah. In terms of painful periods or so, it's a very common issue, and often the answer is very simple and the treatment is very effective, but it may underlie something else. It may be fibroids, it may be some infection, it may be a cancer. So if you're having regular painful periods, go and see your general practitioner or even a gynecologist, and they will actually rule out some simple stuff. In terms of gender-specific, again, it's often, so we actually look at the woman or the man and say, is there a family history of X, Y, and Z? And then we actually then routinely do that. If, for example, a man is in his 30s or 40s and is trying to have a baby, and is not actually being successful, we actually look at their sperm. We look at their sperm count, their sperm percentage, the movement of the sperm, because often these things can be affected by lots of things, whether you're diabetic, if you have a thyroid or hormone problem. So men out there who are failing to actually have children also should go for a screening test. So these are much more gender-specific issues that come on. Somebody's asked about thyroid testing. Thyroid is a gland in the neck, and the thyroid gland is a gland that produces a chemical called thyroxine, which is the activity hormone. And particularly in women, after a certain age, they may have thyroid disease, which actually then results in hair loss, dry skin, putting on weight, and we often screen for those people. You talked about heavy periods. If the period is heavy, we often do a screening for iron, because women often lose heavy amounts of blood on a monthly basis. They may become iron deficient. You've seen some women sort of digging around and eating soil. We call that pica, P-I-C-A, which is a Greek word for eating soil, and it contains iron, and that's why they crave the iron in ant hills and what have you, and that tells you that they're iron deficient. So there are lots of ways, and basically a doctor will understand what it is. And of course, if there's a family, if there's what you call it, if you actually poison yourself, whether you're a smoker, when you're taking too much alcohol, when you're taking too many fizzy drinks, we can actually then do routine tests for cancer of the lung. We can do diabetic tests. So we actually can take a history and look at the individual, no matter what age they are. I mean, of course, there are the joint conditions. If you're a young person, your joints are swelling, you're getting backache, which we normally expect in older people, it may be you're developing what's called juvenile arthritis, where you're developing a condition where the body attacks the joints. So it depends on how you talk to your doctor. So when you go to your doctor for medical screening, say, Naka, this is my history, measure my weight, check my sugar, check my blood pressure and cholesterol, and this is my family history. And then he or she will tailor the screening test according to what we found.
Yeah. That makes a lot of sense, Dr. Bhagat. Are there any downsides to getting routine medicals?
That's a really good question, Soso. And the downsides, and people really need to understand that, the downsides are that we have developed very sophisticated technology which is available in the country. And sometimes you're going for a blood pressure check, and then they do, for example, an X-ray, and they find a little white patch in the lung on the chest X-ray, and they start investigating that. And the downside is you're investigating something that is an incidental finding. In other words, you didn't go there for a spot on the lung. You went for a blood pressure check. And then you go down a rabbit hole where you start doing all sorts of unnecessary tests because you didn't come complaining of chest pain or cough. You came just for a blood check. And the same with ultrasound and very sophisticated imaging like MRI or CT scanning. You go for a scan of the kidneys and you find some other issue somewhere else, and the doctor says, shall we investigate this? Often the answer is you shouldn't be investigating it because you didn't go for that reason. And the downsides are that you are then over-investigated, over-examined and intervened on and over-treated for something that is an entirely incidental finding. And that's the downside of our very high-resolution cameras and laboratories that we have today.
Yeah. That makes a lot of sense, Dr. Bhagat. I've learned a lot from you today, and I wish that we could talk about this the entire day. But unfortunately, our time has run out. Thank you so much, Dr. Bhagat, for coming on the Health Check today.
No worries, sir. Take care. Have a good one.